Measles is one of the most contagious diseases in the world, and it can be deadly. Worldwide, measles kills over 300 people each day. Fortunately, there's a vaccine against measles that's over 95% effective in preventing the disease. Unfortunately, not everyone who should be vaccinated is vaccinated. The consequences of not being vaccinated were evident in Minnesota in 2017 measles epidemic. 79 cases of measles were identified, mostly in children, and 22 needed hospitalization. Fortunately, no one died. 90% of the cases occurred in unvaccinated individuals. This was the largest outbreak in the United States this year and the largest outbreak in Minnesota since 1991. After an outbreak like this, these questions arise. Why don't people get vaccinated or get their children vaccinated? Why are some people hesitant to use what's been called one of the greatest public health achievements of all time, vaccination? That's an important question, one that we'll try to answer on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. Today we're going to discuss vaccination hesitancy, or why are people resistant to getting themselves or their children vaccinated. This discussion is prompted by the recent in Minnesota, where we saw a major outbreak of measles among unvaccinated individuals, particularly in the Somali community. Fortunately, no one died, but the risks are high, so it's important to understand why people resist immunization so that we can effectively address their concerns. Joining me in this discussion are Dr. Nusheen Ameenuddin, a pediatrician at the Mayo Clinic and a board member of the Minnesota chapter of the American Academy of Pediatrics, and Asli Ashkir, a public health nurse with the Minnesota Department of Health's Program for Children and Youth with Special Health Needs. She specializes in autism and vaccination hesitancy. Good morning, welcome to our program.
Good morning.
Appreciate both of you being here to talk about measles, but particularly vaccination and why people don't get vaccinated. But so, since we're kind of doing this in response to the measles epidemic that occurred, Dr. Ameenuddin, tell us a little bit about measles, first of all. What is measles and why is it an issue that we should really be concerned about?
Sure. Well, first of all, thank you for having me here. So measles is a pretty serious virus. We typically think of it as causing three major symptoms. One is a body-wide rash. The second is fever and cough. In and of itself, that doesn't sound like such a bad deal, but some kids can have very serious side effects or further advancement of the disease that can require inpatient, that is hospital care, or even further care required.
And people can die from measles, right?
Yes.
And this is a international disease, right?
Yes.
And I thought it had been declared eliminated in the United States.
We thought so too. Unfortunately, that doesn't apply to everyone. We have a much more global society. Sometimes if people have traveled to other places where it has not yet been eradicated and an infected child or adult comes to this country, if we don't have enough people vaccinated, that can then set off potentially an epidemic.
Okay, so when we try to get people vaccinated, can everybody be vaccinated?
There are some exceptions. You do have to have a healthy immune system. If people have had some sort of an assault to their immune system, whether it's an inherent immune deficiency or they've had, say, a bone marrow transplant recently, or they're too young, they cannot be vaccinated. And that's why those people depend on the rest of us to keep up a level of vaccination that will provide herd immunity.
All right, that's right. So I've got a little slide. That's why I was kind of paging through my notes here. We have a slide that shows herd immunity, or the concept. Could you explain what's going on in this slide?
Sure. So I believe it's in the first slide, the one on the left. You have a population that is not vaccinated. So what happens is if one person, a red person, is infected, and the rest of the community is not, it's much easier for that virus to spread. However, herd immunity occurs when you have enough people vaccinated to effectively protect the people who aren't able to be vaccinated. So in the second slide, the one on the right, the people who are in yellow are vaccinated. So they're effectively able to create walls that prevent this disease from breaking through.
All right, so that if somebody gets infected when everybody else is vaccinated, it's hard to spread to the people who are unvaccinated.
Exactly.
So if we have children, for example, who because of immunity or immune problems, they couldn't get vaccinated, vaccinated or too young to get vaccinated, they're protected by the rest of the people in the community.
Exactly.
All right. And Asli, you work with the children with special health needs. So why are you interested in immunizations?
Thank you for having me today. I'm interested in immunization because one of the health problems with children that we deal with causes parents to be hesitant to vaccinate their children, and that is autism. Because if we ask many parents, particularly in this particular community, the Somali community, why are they not coming and vaccinating their children, they say, I'm afraid my child gets autism because autism is caused by MMR. So I'm interested in this because I know how powerful vaccination is. I know how vaccinations are important to protect our children. So I want to be part of this campaign to educate this community, provide them factual information, and help them understand. And I also know why parents are hesitant is because they love their children, and they think that I can protect my child from autism, but I know autism is not caused by vaccination. So I want to provide culturally appropriate message in a cultural way.
Mm-hmm. So why did the Somali community in particular have this notion that there was a link between MMR vaccine and autism?
You know, just to tell you the truth, autism is not a problem that I don't want to say it was not seen in Somalia, but because we had other overwhelming problems with children. Children were dying from simple illnesses like diarrhea and pneumonia. Autism even doesn't have a word in the Somali literature. So when we came to this country, particularly in Minnesota, 2008, there was an increased concern among the Somali community that their children were going to special ed, and the reason was they were diagnosed with autism. So they started asking, what is autism? They will say, what is in Somali word, autism, can you tell me? And I can't find a word, but I have to explain in a phrase or maybe 2 paragraphs to explain to them, including the early signs of autism. So when they went to their care providers and they asked, the care providers either responded, nobody knows what causes it, or they started giving them what are the risk factors that could make a child more susceptible to get autism. And when you are looking for an answer, this community quickly got connected to anti-vaccine groups. And the anti-vaccine groups were very quick to provide the answer which they were looking for. They were told autism is caused by MMR. And we are oral community. That wrong information, which dwelled in this community for a long time, and it spread and captured everybody's mind, is what we are trying now to fight with and provide the factual information. Right. So the fear originates from that.
All right, and I want to talk a little bit more about the impact of, what that fear was, what had happened to immunization rates, and what's being done to change that. But first, we need to take another little break. So we'll be back right after this message. welcome back. We're talking about the measles outbreak in Minnesota in 2017 and the vaccination hesitancy that was seen among some populations within our state. We're talking with Asli Ashkir from the Minnesota Department of Health and Dr. Nusheen Ameenuddin from the Mayo Clinic and from the Minnesota chapter of the American Academy of Pediatrics. Asli, I'm going to show a slide here in a second that really shows the impact or the lack of immunizations that occurred. And you can see on the screen here, tell us what happened. These are, the green line on the bottom is really the MMR vaccination rate from the Somali community, and the blue line on the top is the overall vaccination rate, MMR, in the Minnesota community. And you can see in 2006 it really started to come down. Is this when the fear started to come?
Yeah, as you can see, I'm so proud to tell you that the Somalis are not afraid of vaccines, because it is depicted here that 2004, it was 92%, higher than the general Minnesota population. And then we should look, why did it start declining? Because when people came, they were going straight and have vaccines for, and if you look at 2008, it was that time when the concern of autism started in Minnesota. It was at that time when parents started asking the question of, what is this problem? What causes it? And it was that time when they got connected to Wakefield, who, as we all know, lost his medical license because of providing myth and wrong information related to MMR. However, when the community were connected with those anti-vaxxer and organizations and individuals, we didn't intervene quickly enough to provide the factual information. So they overtook, and they created such a fear that parents started not to provide MMR to their children. And the decline was 7 to 5% until 2013, when we regrouped and we started providing the factual information. We slowed down the decline to 1% annually. But unfortunately, by then, it reached 42, the rate was 42%, where majority of the Somali children were very susceptible to measles whenever there was any trigger, and that trigger came 2017, and we have seen 65 of the 79 kids affected were from the Somali community and were unvaccinated.
All right, and now when most people think about vaccinations, they think about going to their doctor, and that's the doctor. So what did the pediatric community, the medical community think when they're seeing these rates go down, and what kind of response did the pediatricians and family medicine docs kind of take on?
Well, I think we had a two-pronged approach. One was the one-to-one approach that we take every day in the clinic. One of the things that we do at the Mayo Clinic in the Division of Community Pediatric and Adolescent Medicine is that every time a child comes in, no matter what they're coming in for, whether it's a cold or a health maintenance visit where they typically get their immunizations, their immunization status is assessed. So that is asked and assessed at every single visit. And if people decline, my colleagues and I are pretty firm, and we all share the same view of this, that we encourage them to stay immunized according to our current CDC schedule. The second approach we took is more of a population health approach, and with the help of Asli and the people at the Minnesota Department of Health, as well as our amazing Minnesota chapter of the American Academy of Pediatrics, this year in particular, I feel like we all assembled really well and reached out to the Somali community, looked at people who are trusted in the community, the elders, the imams, the religious leaders, and partnered with them to say, how can we reach the community where they're at? How can we go and meet you to help dispel these myths that have unfortunately become so entrenched in the community?
Yeah. And I suspect, seeing your headscarf, that you could connect with the community, the Somali community, better than somebody like I would. Just culturally, I suspect. Was that helpful?
Yeah, I think it was helpful, and it's a little bit ironic because sometimes I worry that the way I dress can be a little bit of a barrier with some patients, but I feel in this case it was a real asset. And I think people like Asli who understand the community, and even though I'm not Somali, I'm Muslim, there's a level of trust. You know, we talk a little bit about implicit bias, but sometimes implicit bias can be good. And so if people kind of recognize someone who they trust for reasons unrelated to our qualifications, our background, that can really serve as an asset in building bridges.
Well, it really speaks to needing a diverse medical workforce.
Definitely.
No, I just want to add to what Dr. Ameenuddin just said. When we did key informant interview with the Somali community about who do they trust to get their health information from, the first person they mentioned was their medical care provider. They didn't say my care provider is supposed to be a Muslim or non-Muslim, but they said we respect our medical professional. But the situation that we happen to be is the time that medical provider has in order to really address the concerns of these families. I just want to bring an example. For example, if I'm a parent and my doctor tells me today your baby is due for MMR, and I say I don't want that vaccine. If my provider tells me, and it is the American way of doing something, like, okay, how do I interpret that okay? My provider is agreeing with me. He or she is not bothered that I said I will not vaccinate, so it's okay, I'm happy. But if the provider would have asked and said, why are you saying no to this vaccine? Then the parent would have spoken about his or her concern, and then the discussion could start. And since they trust to get information from their care providers, most probably they would take the option of going to vaccinate the child. But what time does the pediatrician have for a visit? It's 15 minutes. And in most of the cases, there is interpreter being part of that. So the time is so short. That the provider.
So we take some of the responsibility ourselves. Sure. I want to get, and we're going to be running out of time. So I want to take a little break first, and then I want to come back and talk about what the health department did in terms of outreach, more community oriented. So let's take this little break, and we'll be back after this message. Welcome back. We're talking about measles and vaccination hesitancy with Dr. Nusheen Ameenuddin from the Mayo Clinic and Asli Ashkir from the Minnesota Department of Health. Asli, I want you to kind of take us through what the department did, the Minnesota Department of Health did in response to this outbreak. You've mentioned a little bit about getting involved with the community. What are some of the efforts that went on to try to turn the tide on this?
Well, the work of addressing the autism concern and the declining MMR rate in the Somali community did not start in 2017. We have been doing since 2013 when, among other things, the Minnesota Department of Health decided to hire Somali professionals, and that's one of the reasons that I was hired to help my own community. That was one thing that the department did. Another thing that we did, we identified key Somali leaders who could be partners with us and help us to reach the community with the right message. And these key leaders that we started working with in 2013, 2014 had been an asset during this outbreak. Among them were the media guys who reached out to us when they heard there was a measles outbreak in the Somali community. Every day they called the Somali TV, the Somali radio, will you please, how can we help you disseminate the right message in the community? It was the faith leaders, as you remember, Commissioner, who reached out and they said, what can we do? You know, I'm so proud to say, like, the links that we have made prior to this outbreak really were an asset, an invaluable asset to us, and we utilized and capitalized on that. And I was actually expecting, when there are 58% of Somali kids are not protected, I was expecting more than 65 kids will get. So I'm so glad that we were able to stop it.
Right, and it certainly sounded like you had a big community effort. You had the imams, you had the community agencies, you had the media, and you had the pediatricians really stepped up and changed how they did their practice and how they did their outreach. Well, how have you changed your practice?
So I'm just as persistent as I always am on a one-to-one basis, but also the experience of actually going to the mosques during Ramadan, which is one of the months that Muslims are spending a lot of time with each other and in prayer. It really taught me something. Like, number one, I learned that even prior to what has been happening now, Somalia had one of the highest, if not the highest, rate of vaccination in Africa. So again, this is a very new phenomenon. What I also learned is that it's important for us to reach out and meet people where they are. Some of the unexpected effects were that I had young people coming up to me telling me that they wanted to be physicians. And I think the more we can do to encourage our population to go into healthcare, the more diverse our healthcare force will be.
All right, great. Well, thank you both for the work that you do on a population level, on an individual level, and for the organizations that you represent. Great job. Thank you very much.
Thank you.
I'll be back with a closing comment right after this message.
It's a beautiful day out here. Sunny today with light breezes, giving way to clouds in the afternoon. We could see some light precipitation to moderate precipitation later on, followed by powerful storm-like conditions. 90 miles per hour winds are expected. Authorities are asking everyone, stay indoors. Come on, that's it. Let's go.
In the year 2000, the United States declared that measles was eliminated from this country. What that meant was that there were no year-round disease transmission in the United States. Yet we continue to have cases of measles regularly appear in our country. That happens because measles is still actively present in many other countries and is imported by travelers. Because of that, it's of critical importance to have high levels of immunizations against the disease in order to prevent the spread of those imported cases and prevent reestablishment of the disease in the United States. Disturbingly, we are seeing a slow but steady rise in the number of children who are not getting vaccinated. This is a significant public health problem that puts our communities at risk. Our recent measles epidemic highlighted the urgency of getting people vaccinated. Our conversation today points out that our educational efforts around vaccination must be culturally appropriate, and we must recognize that there are many cultures that need to be considered. So I'm going to end today's program with a video from the rap culture, produced by Christopher Hahn, a medical resident at Oakland County Hospital and a rap artist who has some Minnesota connections. Dr. Hahn is trying to find different ways of getting across the message that parents should get their children vaccinated. Let's watch.
And now, back here to the new warning from the CDC about measles on the march in America.
Behind the outbreak, many unvaccinated travelers, bringing measles back, and an increasing number of parents who won't vaccinate their children.
Tonight, we're tracking a surge of cases, outbreaks now in 13 states. The number of cases growing at a pace not seen in nearly 20 years.
So the measles are back, like a new fad on Madison Ave, wearing rashes like fashion statements. In the matter at hand, it's how a fraction of the nation's been attracted to this anti-vaccination campaign run by hacks, masquerading as experts, making false claims and accusations. And I would sit back and just laugh at every last statement, but I can't, cause the fact is it's dangerous. Acting like we're taking pediatric patients, strapping them down, stabbing with radioactive agents by some mad physician who just finished an amputation in his bloody white jacket and a mask adjacent. Cause you graduated college and you got an education, think you understand data. Let me get your facts straight and take you back to pre-vaccine civilization. What happened when all we had was natural immunization? What that means is, well, you were actually infected with one of these diseases, you survived, you're protected. So keep in mind these could be quite serious. So let's use measles to describe the experience. A virus so contagious it can be acquired by sharing the same space. It stays in the air and it takes 2 hours to wait before it's safe in most cases. A bad fever and rash, and most people are fine, but on average 1 in 500 will die, or they'll get brain damage or happen to go deaf if they manage to stay alive. And with millions infected, that's a lot of lost lives. And we made great strides with modern sanitation systems, hand washing, water contamination, but even with that, diseases ravaged the nation till we were saved by genius achievement, vaccination. So listen up, this here is a science lesson about bacterial and viral infections, how injecting some material has got us protected from the worst serial killers nature ever invented. So this is a psychology class, we repeat that same something goes wrong, we have to blame something, we protect our offspring, but problem is we're afraid of the wrong thing. So each infectious agent's like its own special agent with its own 007 identification, and once we unlock the code, it's lock and load, immune system zones in, and that virus got to go. Antibodies attack, tracking down the pathogen, and remember the pattern in case they ever come back again. But we need time to rev up the system, so in the meantime you develop some symptoms: the cough, fever, nausea, diarrhea. So fatigue can only speak in onomatopoeia. Then we got the idea to use an injection to expose you to the code, but without the infection, to mimic the situation, stimulating the system and get it habituated without you getting sick. But you see, in some patients can't give it in some cases. Weak immune systems, infants of young ages, but of the whole population there will be a small fraction that gets inoculated but won't have a reaction. They depend on the rest for medical reasons to keep them safe from vaccine preventable diseases. The virus is a forest fire, these people are the trees, and the rest form a fireproof shield with vaccines. Cause you vaccinate enough people in your community, protect the most vulnerable. It's called herd immunity. Listen up, this here is a science lesson about bacterial and viral infections, how injecting some material has got us protected from the worst serial killers nature ever invented. So this is a psychology class, we repeat that same something goes wrong, we have to blame something, we protect our offspring, but problem is we're afraid of the wrong thing. My own infinite home, infinite love, grown every minute, it's like I don't wanna blink. And yeah, I'm scared of autism, but the cause isn't known, and all wisdom is shown, there's no link. I got my own infinite home, infinite love, grown every minute, it's like I don't wanna blink. And yeah, I'm scared of autism, but the cause isn't known, and all wisdom is shown, there's no link. Cause the paper that said this makes kids autistic is based on false data and fraudulent statistics. The author that did this paid the price when it cost him his medical license. Still caused a huge distraction from the true concern, the real cause of autism. So much yet to learn. Still some don't vaccinate, ignoring evidence. An epidemic infection's been soaring ever since. Not a lack of intelligence, they wanna be safe, just don't know who to believe. Guess we've all lost faith. We don't trust Congress or our teachers. Our preachers might not trust your doctor or trust me either, but believe this, we care about public health. We get buried in debt and go through years of hard work because we care about others, not just ourselves. And when it comes to the kids, wanna give them a shot, just give them a shot. Vaccines are the answer, believe it or not. They can even stop cancer. The reason we've all gotten to take for granted that smallpox been eradicated from the planet, like we all forgot that now we're growing old, knowing no one who's been paralyzed by polio. Then you go and question something like this. You're out protesting and pumping your fists, looking for a connection that doesn't exist. You're just spreading infection, putting others at risk. And I get it, cause we're made to save our offspring, but problem is you're afraid of the wrong thing.